Hello viewers, there are many of you who have some doubts about your dental crowns. So today I have made a very special video especially for you to understand the science and the rationale behind selecting your crowns. Okay, what is a dental crown? Okay, first we have to understand what is a dental crown. A dental crown is a protection kind of thing. It's a thing which will help you to restore your teeth to normal function. Say for example, your teeth has got three layers: enamel, dentine and pulp. The pulp is the vital structure which is protected by the dentine layer and the enamel layer. So once the enamel goes off, we start getting sensitivity because the dentine layer is exposed. So in order to rebuild your teeth, we make crowns and give it to you. Is it mandatory that I have to go for a crown? This is the question many of the patients are asking. Definitely it is mandatory, because as you start eating and eating and eating, your teeth starts getting worn out. So for many people there will be wear and tear problem. So during wear and tear, what happens is your facial height reduces and your muscle starts chewing more and more and more to chew the same amount of food which you had. Say my tooth was proper, my face used to be like this. So when my teeth starts getting worn out, slowly my face height reduces. So my masticatory forces are becoming erratic, and I started developing headaches and joint pains and all that. So to avoid that, it is always better to restore your crown back to its normal shape and function. So to understand the importance of crown, we want to tell you now why the crown is important. So by this time you must be thinking, okay, crown is important. What are my options? So people have to know the treatment options available for your crown. So to understand that, I have kept a demo of the crowns in a very nice way. So you can see the teeth now. So if you see here, this is a prepared tooth. If you see, this is a tooth which is prepared. You cannot put a crown on a natural tooth which is already normal in shape. So we generally reduce your tooths to the particular shape, and we fix a crown like that. So once we fit it in the mouth, it will become very normal like that. Okay, there are many people who ask me, sir, which crown I have to choose, and can you suggest us few things? So before explaining the types of crown, if you go and tell any dentist about a crown, it is generally like a sari. Sir, I want a sari. So what happens is the shopkeeper will ask you what kind of sari you want. You want a silk sari, you want a nylon sari, you want a cotton sari, you want what kind of sari, like that. When you ask generally your dentist about crown, there are many varieties of crowns are available, but most of the dentists, if you talk in terms of money, they will suggest you some materials which are not going to be helpful to you in restoring your function for a long time. So which means if you select a crown based on the price without knowing the material science inside it, so what happens is you lose that tooth very early. Say for example, these two look alike. See, when I turn like this, both of them look alike, but they both have polar difference, like North Pole and South Pole kind of difference, because this is a plastic material with the steel support. This is a ceramic material with a steel support. So both are having a lot of difference. These are the basic material variety. Say if it is level 1, which is lower, and level 2, which is higher, and you see the next level would be a patient, next level would be like this, a ceramic with complete shiningness. This shining ceramic surface is helpful for maintaining the hygiene. The dental problems are caused because of the plaque accumulation, because of the food particles. So if you have a shiny surface like this, instead of a surface which is actually shiny, but you see this also has got its negativity. Like when you yawn, when you open your mouth, people could see this metal and may ask you, what is this? What happened to your teeth and all that. So you may have to explain some big story behind it. So but if you choose a tooth like this, which is a ceramic tooth, you can see both the sides have got a nice ceramic build-up. But if you actually see, there are so many technical nitty-gritties to understand. So I am taking a high definition video. If you see, this ceramic edges are very smooth in surface and there is no rough surfaces. Whereas if you see, there is another ceramic crown I am holding on in my hand. This has got very roughened surfaces. Can you see? Lot of rough surfaces are there. So these kind of rough surfaces will be sitting very close to your gum margins. So when the thickness is more, food particles will stay in that rough margins, and this will cause cavities, root infections again and again in your teeth. So when you take buy a ceramic crown, say this ceramic crown, if you see, this is a handmade crown. Okay, the surface, if you see carefully, this and this, can you just pick it up? If you see these two surfaces, which one is nicer? The one which is on the right side. It is very smooth, the margins are very polished, very thin, and this is having 1,000 rupees difference from this and this. Say in our clinic we roughly charge around 5,500 to 6,000 rupees for this crown. Both look alike. Okay, both look like this from outside. Both look same, exactly like twin brothers, but inside, if you carefully see, the edges are rough, the thickness is more, and this is having a nice sandblasted surface and thickness is very less. So when the thickness is less only, it will look very natural. Okay, is there any technology which has come which is more advanced than this? Yes, we have something called zirconia. Can you see, there is no metal at all? If there is no metal, it is very good for your body, because the elements in the metal can cause some kind of disturbances in your system, biological system. That is why people wanted to go for metal free. But can you see, it looks very whitish and it looks very natural, because the light from a mobile phone is easily passing through this ceramic crown. The light from the mobile phone is not passing through this, it is getting reflected back. That is why ceramics are opaque in color. So for replacing your front tooth, it is always advised to go for this ceramic crown. But if you see, for replacing the back tooth, if you don't want to go for this, you can go for this. But the advantage of selecting this would be, again there is no metal, the thickness is uniform, because the process is done using a CAD/CAM technology. It is not made in hand, it is drilled and milled by the machine, and the glossy surface has been, the zirconia has been sintered in a furnace, and it goes through a varieties of process and it helps. So if you carefully see, there are many materials in my table. So if you see, this is also a ceramic one, and say normally we in our clinic we charge roughly around say 3,500 rupees for this material for one unit. This will be roughly around 1,500 to 2,000, because this is just a plastic. And if you see, this is a material we charge roughly around 4,500 for a ceramic crown. This is a material we charge around 5,500 for a DMLS crown, and this we charge around 8,000 to 10,000 rupees, even up to 18,000, 20,000, depends on the warranty and the material brand we use. This kind of material changes are there. So dear friends, if you see now, without knowing the varieties of materials available, if you go and just say your crown is expensive, if the doctor has not communicated to you the reasons, the way how I explained to you, sir, these are the materials available, there are so many things there. If you don't know this, you will always feel crowns are expensive. The more expensive material you use in dentistry, the more good it will be, because the material premium will give you more comfort in function, more beauty and more aesthetics, and if you see, very natural looking it will be. So dear friends, in choosing your crown, you should be really wiser, because if you think only with the price structure, sometimes you may, if doctors doesn't explain, they may not give you this expensive one, rather they may give you a plastic one and they will charge you. So always please ensure what material you are receiving, whether it is having a metal or whether it is having a non-metal, whether it is made by a casting process or by a milling process, a CAD/CAM process. So prefer going for a CAD/CAM process, because CAD/CAM process are highly precise, highly, you can zoom and see the margins very clearly, so food impactions will not be there, your hygiene factors are improved. And if you really like this video, please share this video, because many people don't know how to select a crown. So I thought I'll make a video like this and help the people. Thank you and God bless you. If you have any doubts, you can put it in the comment column. Thank you and God bless you.